When should endodontically treated teeth be crowned? Does this tooth need a crown? In general, anterior teeth with minimal access preparations and intact marginal ridges do not need crowns. And if an anterior tooth does not need a crown, it also does not need a post. In this study, uncrowned teeth with posts showed no improvement in prognosis over uncrowned teeth without posts. But what happens if we don't crown an endo tooth that needs a crown? These researchers followed patients who had endodontic treatment. They found that non-crowned teeth were lost 6 times more often than crowned teeth. That's a big difference. These researchers in Thailand followed patients who had molar endo but no crown. The 1-year survival rate was 96%, the 2-year survival rate was 88%, and the 5-year survival rate was only 36%. So after 5 years, about 2/3 of the molars that were never crowned were gone. But that's not all they did. They created a classification system based on the amount of tooth structure remaining. Class 1 was like a Class 1 lesion with all of the surrounding walls at least 2 millimeters in thickness. The 5-year survival rate for these teeth was 78%. Stop and think about that. This study seems to suggest that 1 out of 5 molar endo teeth with minimal access cavities will be lost if we don't crown them. Class 2 is like a Class 2 lesion with at least 2 millimeters on at least 2 walls. The 5-year survival rate for these teeth was 45%. More than half of these teeth were lost. And Class 3 had less than 3 walls with 2 millimeter thickness. The 5-year survival for these teeth was 18%. 82% of these teeth were lost in 5 years. These researchers also found that composite-treated teeth perform better than amalgam-treated teeth. This is most likely because the amalgams were not bonded and the teeth were weak. In any case, most of these teeth that were not crowned were lost. So whether or not we use amalgam or composite is moot. We should be crowning these teeth. In class this week, we will look at whether or not this is a valid study. This author found that endo-treated maxillary premolars with 2 or 3 surface amalgams have a high incidence of fracture. Endo-treated upper premolars with previous sizable restorations should be crowned. The author concludes that amalgam, especially in MOD cavities, is an unacceptable material for restoration of endodontically treated posterior teeth. Again, these amalgams were probably not bonded, and crowns would be better than amalgams or resins because these teeth are weak. From your fixed textbook, in general, endo-treated posterior teeth should be crowned. Exceptions might be lower premolars and first molars with conservative access cavities, intact marginal ridges, and absence of excessive occlusal forces. Even if we have a conservative access, we need to consider a post in cases of big access or big instrumentation of the canals, horizontal cracks on the crown, or heavy function. So it seems that most endodontically treated posterior teeth should probably be crowned.